Hello there. This is a special edition of Data Point, where we want to focus on some of the issues that have been affecting the rollout of the social health insurance. We know that recently, I think it was last week, the High Court, a three-judge bench, decided and found that three laws, the Social Health Insurance Act 2023, Digital Health Act 2023, as well as Primary Healthcare Act of 2023 to be unconstitutional for various reasons. But the same court stayed the implementation of the decision for a period of 45 days. But in the same decision, they had given some 120 days to Parliament to correct the anomalies and, of course, make it constitutional based on what they found, including the question of public participation. But for now, in this episode, I want us to focus on what the packages under the social health insurance packages were. And we'll begin by, first of all, appreciating, just reminding you what you're supposed to be contributing. It is 2.75% of your income. If you are formally employed, then it is taken off your salary. If you do informal businesses, then it's going to be to take an assessment of your income as a household, which is something they are calling means testing instrument. But out of that, you have to pay 2.75% of your income to the Social Health Authority. Then there is another fund that is called the Primary Healthcare Fund, which is supposed to be coming from budgetary allocations. We'll be looking at the figures in the current financial year. Emergency, Chronic and Critical Illness Fund. At a time that you may have exhausted your SHIF packages or your SHIF contributions and allocations, then this is would step in to finance your healthcare services, and that would be would have to be budgeted for. Then there is indigents, people that are not able to pay for that contribution. It is supposed to have a budgetary allocation from Parliament to ensure that they are also covered for universal health coverage. Now, the Finance Bill of 2024, which was withdrawn by President William Ruto, has been blamed for the following issues. And the Minister of Health indicated that because of that, the Emergency, Chronic and Critical Illness Fund is going to be affected. The Primary Healthcare Fund is going to be affected, as well as funds for indigents and vulnerable persons. They were going to be affected. And therefore, the SHIF rollout was suspended. It was supposed to take effect on 1st of July 2024. Now has been pushed to 1st of October 2024, but again, based on the High Court decision, then that there are some questions as to what will happen to it. Let's quickly look at the budgetary allocations. Remember, the primary healthcare is supposed to be allocated resources from Parliament. Currently, it's allocated 4.1 billion shillings from the current financial year budget. The Emergency, Chronic and Critical Care Fund allocated 2 billion shillings. And indigents, people that are not able to finance the contributions, zero allocations in the budget, but there's some 861 million shillings allocated to orphans, elderly, and persons with severe disability, which is obviously in the current financial year budget. Now, these are some of the packages that you need to be aware of, that 900 shillings was allocated per person per year for the primary healthcare services. So if you had to take the population of 51.5 million shillings, 51.5 million in population, which is an estimate from the Kenya National Bureau of Statistics, times 900, then you'd require the national cost to be 46.3 billion shillings, meaning Parliament should allocate 46.3 billion shillings as the resources for primary healthcare. But currently, the allocation that was passed by Parliament is 4.1 billion shillings. That's actually less than 10% of what the country would require. Beyond that, let's focus on something else. In the packages, of course, you're talking about the primary healthcare, talking about basic radiology and management of non-communicable diseases, among other services, the minor surgical procedures, the immunization, management of sexually transmitted infections, as well as HIV and AIDS, and hospitals affected by by primary healthcare would be levels 2, 3, and 4. There's another fund which is called, or rather, before we get to the fund, the inpatient services that the primary healthcare fund would be paying 2,400 shillings. This is your allocation as a package that is per day, a maximum of 50 days, and this would go to level 3 hospitals in terms of the inpatient services. Let's take a look at something else, and this is the maternity services, which is one of the crucial services in the health sector. For normal delivery, SHIF will allocate you 11,200 shillings. For Caesarean Section, that will be 32,600 shillings for a birth. And of course, if you had to go to some of the private hospitals in the country, you'd find that it can go even up to 10 times of that or even more. But now this would be the financing across all level 2 up to 6 hospitals, regardless of the costs that will be demanded. Obviously, if it's more than 32,000 for Caesarean section, you may have to top up. For optical health services, this is according to the Social Health Act. The regulations indicate that one of the packages is a consultation for eyeglasses. That would be allocated 935 shillings, too low for any person who has ever sought services of consultation about optical needs as well as eyeglasses. And there's a limit of 1,000 shillings per household. And therefore, if, for instance, one of the parents goes and gets eyeglasses or consultation for 935 shillings, that leaves just about 65 shillings for the rest of the households to share. And this is assigned to levels 2 to 3. If you had to look at the packages, there is no mention of optical health services in level 4 to 6, raising a few questions there in terms of services available. Now, for more, the consultation allocated under the Social Health Act packages, you're talking about 2,000 shillings, and inpatient services would be between 3,500 shillings and 5,000 shillings per day. And these are different levels, meaning that if you're admitted at a level 3 hospital, the allocation is 3,500. For a level, a higher level, that would be about 4,000, and the maximum is 5,000 shillings per day. Obviously, this is level 4 to 6. Actually, 3,500 for level 4, about 4,000 for level 5, and about 6,000 for level 6. Let's take a look at something else, and these are some of the key services and these packages. For dialysis, it is allocated some 10,650 shillings per session with a maximum of 3 sessions per week. And but of course, the other categories of dialysis that would be have been allocated higher resources than this. For chemo administration, it has been allocated 5,000 shillings. Obviously, this being a package, if your cost is beyond this, then you may have to top up depending on the facility that you are visiting. For emergency, chronic and critical illness fund, remember this is a fund that is supposed to kick in once you have exhausted your SHIF packages. And for ambulance evacuation, it has been assigned some 4,500 shillings if you're within 25 kilometers from where you are to the nearest facility. If you go beyond that, then the package will allow a spending of 75 shillings per extra kilometer, so you can calculate there and see what allocation that would be. For ICU hospitalization, there will be 35,000 shillings assigned to you per day, but a maximum of 14 days. And obviously, if there's any extra costs, then you have to do what is called co-payment. For HDU, high dependence unit, the allocation is 10,000 shillings, maximum 10 days. That's about 100,000 shillings at every time that you need admission, but also that is every year. So anything that goes beyond that, you will have to co-pay. And of course, it doesn't close the window for you to take other medical insurance cover, but as this stands, it's not clear when these packages will take effect, knowing too well there's a High Court order on those 3 laws being unconstitutional. It is not clear if they can be implemented with the unconstitutionality, knowing that the High Court has already stayed that decision for 45 days. There are questions as to what happens, knowing that the end of those laws or the NHIF should be on the 21st of November 2024. Will the country have managed to correct those anomalies and come up with a clear pathway towards what should happen to those laws? And also, what happens to NHIF should we find ourselves that the country is not ready to transition to correct those anomalies highlighted by the High Court? And that's a special edition of Data Point on SHIF packages and more, included after the passage of the 3, or now 4, crucial laws by Parliament.